it's a little different versus like a physician, I think. But one of I call it a pet peeve, which I'm trying to let go of, is when patients say, "Oh, you look really young," because my fear is that they associate me looking young to the level of my education.
Sure.
So I always try to I'd be like, "Oh, thank you," and then just tell me more about yourself or why you're here. But on Friday, they were saying you look so young, but then patients started adding, "But you're so young and beautiful." I was like, "Oh, I prefer that versus just you're young."
That makes
So,
sense. It's not unreasonable for you to have that thought. That is a judgment that other people are putting on you.
yeah. And
It's
I try to correct them nicely or not, not feed into it.
good.
But it is something that I wouldn't say struggle because I can't change that I have a baby face or like
Right.
that I look young. It was just like, yeah, but I try to more just educate them. I'm like, it's 11 years for this career. Like I did 3 years of surgery. They're like, oh, I didn't know that. So I try
Yeah.
to educate more than like judging them. I do correct them when they compare me. I get a lot of Spanish speakers. Someone's like, "Oh, you look like my granddaughter." Or like, and I'm like, "Oh, but I'm not. I'm your doctor."
Yeah, exactly.
So,
That has to be tough. It has to be tough. I can understand why that's a challenge. What I'm loving hearing is that you're finding that being compassionate and loving back to them is really important to you.
yeah.
So,
No, of course, because I think it's all about trust, and I think that's why my patients keep coming back.
yeah.
So,
Yeah, that's awesome. Well, that's your purpose in this life is
yeah,
to serve, and you're serving in a direction that's in a medical genre, and
correct. Yeah.
you know,
But I
yeah,
will say yesterday, along with the physician complimenting, it was nice to hear patients not only say I'm young, but more like, "Oh, you're beautiful and young." I was like, "Okay, like I'll take the beautiful." Like, thank you. All right, now tell me about your foot.
tell me about your foot.
I mean, I have
Yeah.
to redirect it anyways.
Yeah, well, that's smart because you're taking control of the energy.